Hey everybody, I'm here with Dr. Jason Stepkovitch at CNY TMS Psychiatry. You can find them at cnytms.com. So we're here to talk about their treatments with mental health and the success they've been having with patients. So doctor, thanks so much for joining us today. I really appreciate it.
Oh, thank you, Caleb.
Yeah, and I wanted to start off just by asking how long you've been working with patients on their mental health.
Well, I graduated from med school in '01 and graduated from psychiatry residency in 2005. So for a long time, I guess over 20 years, if you count, the beginning of my psychiatric training.
Yeah, definitely. Yeah, and congratulations on that. I really appreciate you, dedicating your time to that.
Thanks.
Yeah, and I wanted to just ask too, was there anything in particular that really drew you towards, working with those patients and really just got you, motivated to go into that field?
Well, in psychiatry, we tend to overthink things, right? So I've certainly put a lot of time into answering that question. Probably haven't fully answered it, but I think as I think back, even as a young person, I was always drawn to stories. And I really loved books and literature. And even as a pre-med student, in my undergrad years, that was really my first decision before, I decided to focus on mental health. I was always drawn to questions about meaning, reading Viktor Frankl's classic work, Man's Search for Meaning. Another seminal book for me in my younger years was the M. Scott Peck self-help book, The Road Less Traveled, which a lot of folks have read. And those really got me thinking that I really wanted to be a psychiatrist. But, I think one of the things that I've always stuck to in psychiatry is, and I'm still sort of fascinated by this, is that people bring their stories into our offices.
Mhm.
And it's still so powerful.
Yeah.
And it's such an honor for me to sit in office and listen to people's stories, but also to go on that journey toward meaning,
Mhm.
which, I think, we should all be searching for, that I'm still continuing on. But to be able to do that with my patients is amazing.
Yeah, definitely. Yeah, I'm sure you guys see, patients from all different walks of life, and they all kind of have their own unique challenges and things that, I would imagine can be, difficult to deal with. But if it's something that you're able to help out with, I would imagine it must be, really rewarding for you guys.
Yeah, no, it's really gratifying work, and it continues to be 20 years. And yeah.
Yeah, that's great. And I wanted to find out from you too, what do you feel like are some of the most common mental health concerns that have really just, seen an increase over the last couple of years with everything that's been going on?
Well, I would say in general, if you look at anxiety and depression rates, those have been going up for a long time. And I don't think we have a good handle on why necessarily. Um, the last couple of years, I would say I've seen an uptick in things like hopelessness,
Mhm.
loneliness, um, and an increase in distrust. And I think when you're seeing that in individuals, invariably you're going to see, increase in anxiety and depression and things like suicidal thinking. Those are going to follow from that.
Mhm. Yeah, I think that's a great point. I think the kind of distrust, and I think, as awesome as technology and everything's been, being able to do calls like this and all that, it's also had a lot of negative effects too, with social media and
Absolutely.
everything on patients.
Yeah, absolutely. Yeah. I think that there's a lot of aspects to our modern living. Like, I don't think my field has a firm handle on this, on the why necessarily, but I definitely think that there are things about modern life, certainly things about, the last couple of years, the impact of social isolation, of hunkering down, the mental health sequelae, the deleterious mental health
Mhm.
sequelae related to that. I think we're still coming out of that. And the atomization of society, and I think we'd all agree that things are just more tribal
Mhm.
maybe than they used to be, which creates schism and disconnection. So I think all of those things are challenges that we all face,
Yeah.
to not allow ourselves to get sucked into those things.
Mhm. Yeah, I definitely agree. And what do you feel like are some things that patients can do to, really just keep a healthy mental state and be able to, just really just practice mindfulness and not get sucked into so much of that?
Well, I think first of all, it's like it starts with, I think, just being honest, right? Like, I think the world has always been a bit chaotic and uncertain, right? That's not new. It seems I'm hearing more though that people feel like a heaviness and a burden. a burdensomeness that I didn't hear as much before. And I think that that's maybe a bit of a distortion. We've always been, even when we've perceived that things were maybe a little bit more stable, we've always been one illness or one tragedy, away from life being upended, right? And so I think it's important that we focus on, really making sure that our daily habits are, really good. Are we exercising? Are we focused on diet? Are we giving ourselves time? Like, are we affording ourselves time to attend to our mental health? Like, are we giving ourselves time to think? Are we giving ourselves time in our busy daily lives to, actively participate in meaningful relationships, both family and friends? And in that time to think, yeah, I mean, things like a mindfulness practice, absolutely, like that could be really beneficial. It could be for another person, walking in the woods. It may be for another person, or it could be all of it, right? Or just having time to, to read a good thought-provoking book. Are we doing those things? Too many of the time we're not.
Yeah, I think that's a great point. I think those are all things that, we can really take for granted and really just not fully understand how much those can really help us, especially if we get used to, just being on our phones all the time, just watching TV and really just getting, drawn into that, really not focusing on those things that really do make us a lot happier.
Yeah, it's very easy, isn't it?
Mhm.
Yeah. Yeah.
Yeah, absolutely. And what are some of the treatments that you guys offer there at your practice for patients that, are doing those things, but still just not finding, relief and really the satisfaction?
Well, I've had a private practice for a number of years, and in my private practice, I do psychotherapy as well as medication management. And I've always had a bit of an ambivalent relationship with medications. Um, Prescribe them, daily, and I have for 20 years. And I'm not certainly not against medications, but I think if you were to speak with a lot of my colleagues, they would feel the same way. Um, there's a frustration that they don't work better,
Mm,
right? And I think that they've been over marketed and over promised, and unfortunately, I think my field has played a role in that, if we're being honest.
mm,
And I think we've desperately needed alternative treatments, and it's sort of an exciting time to be a psychiatrist right now. So 3 years ago, we started our TMS practice, and TMS stands for transcranial magnetic stimulation, right? So TMS utilizes a magnet about the power of an MRI, which generates an electromagnetic current.
mm,
And with the power of electromagnetic fields, we're actually able to elicit neuronal depolarization, to stimulate like the firing of neurons in the brain. And we're able to kind of target very specific parts of the brain depending on the condition that the patient is suffering from.
yeah.
So that's been very exciting to be a part of that, very gratifying work. And really been kind of I think a game changer. And I think anybody doing TMS will tell you the same thing. Like, some of the results we see are very dramatic in ways that, I'd be hard pressed to think of similar results with medications.
Mm. Yeah, definitely. I think, part of that field too must be really challenging because, you really have to work with what you have at your disposal there too.
Right.
Yeah.
Right. Yeah. No, no, absolutely. Like, when you look at, like the largest antidepressant study ever done, that's the STAR-D study. It goes back to 2006. That's a National Institute of Mental Health study. Um, and they looked at, they took an algorithmic approach to folks with, this was folks with depression, and they walked them through a standard algorithm of treatment. By the time somebody got to their fourth antidepressant and they were still depressed, remission rates in that study hovered around 13%.
Mm,
And that's, kind of like pretty much what a lot of psychiatrists have been sort of stuck dealing with. It's, I sort of equate it to having to go to Vegas and think you're going to beat the dealer, and sometimes you do, right? And that feels really good, but you're not going to beat the dealer most of the time.
right.
So a lot of I felt always like my work was, hanging in there with the patient, hanging in there with them as they were depressed.
Mhm.
And so to have other treatment options, that are really very effective. And in the case of TMS, in that like difficult to treat population, TMS is really, nearly 3 times more effective, like 40% remission rates, 70% clinical response, which is defined as like a 50% improvement in symptoms. So that's, just standard TMS treatment. So, over 70% of individuals in a lot of clinics are coming away with significant improvements in their symptoms.
Yeah.
Yeah, it's really been a game changer.
Definitely. Yeah. And I think one thing you mentioned too that's pretty impressive is the fact that that's with patients that have tried those antidepressants and have.
Right. These are the patients that that a pharmaceutical company would not want in their studies if they were going to, if they were going to bring a new drug to market. Absolutely.
Right.
Yeah.
Definitely. Yeah, that's incredible. And
Yeah.
with patients that do the TMS, do you typically, want them to continue their medications through the treatments, or how do you usually handle that?
Well, we recommend maintenance therapy. Yeah. So if you look at, TMS is a very durable treatment, more durable than antidepressants. So when you're out, about 70% of individuals, if they do nothing, will still be doing well.
Okay. Wow.
We don't have longer follow-up studies, at least not that I'm familiar with. And doing maintenance treatments, which is just that, maintaining one's gains. Our patients have put a lot of personal and maybe even monetary investment into their mental health by going through the treatment. We do, sort of as a rule at this point, recommend that they invest a little bit more into, some form of maintenance treatment. And actually a meta-analysis done on maintenance showed that, roughly, I think it was 56% of individuals, or there was a 50% reduction in relapse risk for individuals who engaged in some form of maintenance protocol. Unfortunately, I don't think the insurances are quite on board with that yet, at least in the state of New York. So you can't get insurance reimbursement for maintenance treatment. So, for that reason, it might not be for everybody, but if you can afford it, yes, it would be something clinically that I would recommend.
Okay. Yeah, it definitely makes sense.
Yeah.
Do you recommend, having any other types of, treatments along with that? Like if they were doing, talk therapy or anything before that, I would imagine that, it helps them be able to make some more kind of breakthroughs with that as well.
Yeah. I very much do not think that TMS is like something that should be considered a standalone treatment for the vast majority of individuals. It should be part of a comprehensive treatment strategy.
Sure.
Right. So, I'm a psychiatrist that very much supports the idea of psychotherapy, which is also neuromodulation, right? The idea that, you're working on neural connectivity, synaptic connectivity through the power of human connection, and human communication.
Yeah.
So I think, doing TMS is a great time to double down on psychotherapy. I think you had brought up mindfulness earlier in one of your questions, that would be a great time to maybe start something like a mindfulness practice. And it's also a great time to like double down on those like daily life skills that so many times when we're really depressed, we're just not engaged in, diet, exercise, reconnecting with, important relationships in life, all of those things. So, very much like we very much like reinforce the importance of like a comprehensive strategy with our TMS patients.
Yeah, absolutely. That's a great point. And I think you mentioned a little bit what's the average number of treatments that patients typically need to start, really seeing some good results with the TMS?
Well, it really depends. So the standard like FDA approved depression protocol is 30 sessions. So that would be 5 days a week for 6 weeks. And then there's a 3-week taper. And that's what most people do. Of course, there are a lot of off-label indications, and we do a fair amount of off-label stuff in our clinic here. And so they may have different protocols with different, varying times, lengths of time. Like we actually do a fair amount of memory treatment for mild cognitive impairment. My wife, I share the office with my wife, who's an internist, and she's board certified in geriatrics. Like as an example, that's a 20-session protocol. This is a treatment that can actually be effective for tinnitus. That's a 10-session protocol. So it's going to be different depending on the condition. There's also an accelerated protocol. So Stanford last October published a study called the SAINT study. And in that study, they compressed all of those treatments into 1 week. So it was actually 50 treatments and not 36. and the patients would come into the clinic at 8 a.m. Well, I actually don't know the time, but but they would start in the morning and then leave in the evening, and they would do 10 treatments a day. So it's a real commitment on the part of the patient.
Yeah.
And in that study, the average time to improvement was, I think, 2.3 days. Yeah, like rather unbelievable. And they were getting 79% remission rates in that study. So we're not able to replicate the Stanford study. They have their own machine. They were also using functional MRIs. Like, we don't have access to those things. But we are able to do a very similar protocol. So I would not advertise that we're doing the Stanford, protocol. It is a different protocol, but it is accelerated TMS. And we've been seeing very good results with that. Not Stanford good, but very good. I would say roughly, 50% remission rates thus far.
Yeah. Yeah, it's great to hear. And so that's mainly for patients that, are not able to do that longer treatment course of the 36.
Yeah, I think it's a lot to ask. I think there's a couple of populations specifically that benefit, that would be a good fit for that. Some folks like in upstate New York, where we're located, they may have, really long drive to a clinic. We've had patients in the past that were driving 2-3 hours to come to their treatment. That's a big ask in an upstate New York winter.
Sure.
For 6 weeks,
Yeah.
right? Professional individuals, that might have difficulty taking extended time off from work to come to daily treatments for 6 weeks, but also folks that are maybe, really struggling, and they may be facing hospitalization, and, but might be able to sort of constitute themselves for a week and do 5 weeks or 5 days of TMS treatment. So I see those, being sort of niche patient populations where accelerated TMS may be more appropriate or a better fit than standard TMS.
Yeah, I think that's awesome that you guys recognize that need for, that type of treatment for those patients if they're not able to do the standard, TMS treatment.
Yeah. Yeah. And again, like, most of our treatment is still standard, so I don't think accelerated is for everybody, but I think it is. Yeah, I think it's been an important tool that we've, been fortunate to be able to offer it to our patients. Absolutely.
Yeah, definitely. And what do you feel like makes a patient a really good candidate for, either the traditional TMS or the accelerated TMS?
Yeah, that's a good question. So clinically, I see it as sort of a first line treatment, right? So if cost were no object, my perfect world, if somebody came in and said, I'm struggling a little bit with depression, anxiety, I really don't like the idea of taking a medication. Would you do TMS? I would do it.
Yeah.
The FDA might not agree with me, and a lot, some other individuals might not agree with that. And I get that. So the FDA approval, again, is for treatment resistant depression, 2 failed drug trials. The insurers really don't agree with that. So depending on the insurer, they will want to see at least 2 failed medication trials. Most of the major insurers up here in New York want to see 4 failed med trials, even with sometimes combinations. But personally, I see TMS being, it's very safe and very effective. So I wouldn't have any qualms, about treating somebody who maybe had like a philosophical concern, about taking medications, or, there are people that just are very sensitive to medications in general and are a bit trepidatious, understandably, about starting an antidepressant. I would also say, though, that if somebody had mild to moderate depression, Prozac at Walmart around here, I think, is $4 for a 30-day supply. So I would still probably start with Prozac.
Yeah.
Yeah.
Yeah. And is there any, like contraindications or anything that you would look out for, anything that would make them, specifically not a good fit for it?
Ferrous metal in the head, which is pretty rare, cochlear implants, and active seizure disorder. So seizure, TMS is very well tolerated, very safe, with very few side effects in general. When we do see side effects, it's usually some scalp irritation, site irritation, and that's usually early in the course of treatment. Some folks do seem to get a headache, even though this is also used, interestingly, for migraine headaches off-label. I think it's actually a very effective headache treatment. And we do see our folks, many of our folks who have migraines, seeing improvement with their migraine headaches as they progress through treatment. But early on, that can trigger some headaches. But yeah, the seizure is the big concern. It's still a very low risk. So, I compare to, say, Wellbutrin, a commonly prescribed antidepressant, has a much higher seizure risk than TMS. And, I've never really been overly concerned about Wellbutrin. And I don't know any psychiatrist that, it's having the patient sign their life away, before prescribing Wellbutrin. But, there is a seizure risk with TMS as well.
Sure. And is it just because it's, located near the area, the part of the brain that's going to control movement and everything, or?
Well, it should, it shouldn't be too close to that, so I guess that would be, one thought that there could be technician error. We haven't had a seizure, and I'm hoping that we don't face this. Maybe at some point we would. In talking to docs who've had seizures in their clinic, I know one of my friends, he had a seizure, and TMS had unmasked, some organic issue going on in the brain. Like, they actually had a benign tumor that was picked up after they had a seizure from their TMS treatment. But yes, obviously stimulating around the motor cortex at, high amounts would dramatically increase the risk of seizure. Yeah.
Sure. And so it's more likely that it's patients that kind of have predisposed conditions that might cause that, as opposed to.
Yeah, a lot of, and we screen obviously for, substance abuse, eating disorder, right? Like, if somebody was maybe actively purging and, had electrolyte imbalances because of that, that would increase the seizure risk of seizure, right? So there are other factors involved that might even, that we may not even be aware of, that might impact, seizure risk during the course of treatment. So we try to mitigate that, through proper screening and, daily asking of questions by the technician to ensure that, assuming that the patients are being, upfront with us, that they're not engaged in activities that would increase that risk unnecessarily. Yeah.
Yeah, definitely makes sense. And, I think thankfully a lot of the stigma around depression has been lessening over the years, and patients do feel like they can, reach out a lot sooner for treatment. What do you feel like are some things that patients can look out for, and, people can look out for in their friends and family if they're trying to, determine if a patient needs to seek professional help, and, just doing those things at the beginning, like we talked about, really just aren't gonna be able to cut it for them?
Yeah, that's a great question. Well, I would start first of all with, like, philosophically again. Like, I feel like anybody can kind of benefit from coming in and talking to a psychotherapist, right? So I don't think that you have to, have profound mental illness before you seek out professional help. And as you talk about, like, the destigmatization of mental health, I think that that's an important part of it. We should all have mentors, counselors, if not like formal,
Mhm.
treatment in our lives. I think we all need that.
Yeah.
But yeah, when you talk to, like, maybe yourself or a friend or a family member who's struggling, and yeah, when is it time to intervene, and when is it time, to try to help get them or yourself help? Well, I think it, comes down to functioning,
Mhm.
on some level. Like, is there a disruption in daily functioning? Is the person isolating more, more than they normally would? Are they having trouble with basic activities of daily living? Do you see somebody who's just not, it's taking enormous energy just to, get the energy to, take a shower in the morning? I mean, that's sort of a no-brainer, right? Are they struggling at work? Are they missing days from work?
Mhm.
Are they disconnected from their kids, right? Are they the college student that, always went to class, that, now is having trouble turning in assignments? I mean, those are like real red flags, right? Where you want to get ahead of the curve on those things. And too often, I think people wait too long to come into a professional's office. It's best to not wait till it's really bad, right? And we haven't even gotten into suicide, right? So, obviously, if somebody's struggling with suicidal thinking, or let alone like having like a plan, that's not something to be taken lightly.
Yeah.
Yeah.
Definitely. Yeah. And I think that's a great point that, it's definitely worth having maintenance treatments and really just seeing somebody and having something where, you're constantly improving rather than waiting for things to, just deteriorate over time and really just get to a point where you feel like you're so helpless. You absolutely have to,
Yeah,
seek professional help there. So I think that's a great point.
yeah,
Mm. Yeah, and it seems like, I think a lot of patients are realizing that there's no shame in reaching out and getting help there. And it's a lot like, your physical health too. If you break your arm or something, you're not going to wait 2 weeks or a
right,
month or like that to go, get
right.
help for it. You're going to go right away. And there's definitely no shame in doing that with your mental health as well.
Yeah, and I think, our field is starting to put more emphasis on prevention. That wasn't as much the case, I think, when, 20 years ago when I first entered the field. And I think you're going to continue to see more training, more awareness on the part of like mental health practitioners on the importance of prevention. And hopefully we'll do a better job of incorporating prevention into our practices moving forward.
Yeah, definitely. I think it's one of those things too, where a lot of times, if you're just thinking about your actions to yourself, even just, spending 3, 4, 5 hours a day on your phone or watching TV or something, you might think that that's, pretty healthy and it's not that big of a deal. And then you let somebody else know about it and they're like, well, you might want to, try and getting outside more and just, doing these different things that might make you a lot happier.
Right. I think doing things with intent, right? So somebody very wise who's not a psychiatrist told me once that nothing is neutral.
Mm,
And I think that's true. I think things tend to either help facilitate growth in us,
mm,
or they tend to maybe even insidiously a little bit, you
mm.
know, get us to backslide. And a phone is a perfect example of that. I really struggle with that myself. So it's just too easy to click those buttons,
Yeah, definitely.
And meanwhile, like, what are we missing out on as we're doing that?
Right. Yeah, exactly. That's a great point. And what would be the best way for patients to get in contact with you? I know, patients can obviously reach you guys if they're local, but you mentioned that, you guys have that program for patients that are a little bit further away as well.
Yep. Yeah. So our website, if which is www.cnytms.com. There's a lot of information on how to contact us through the website. You can message us directly through the website. People can also call us directly, and I can give our patients our number. It's 315-671-2140. And I'm very fortunate to have really good staff. So staff here can, walk individuals through what might be the best fit for them if they were to choose, to seek care with us.
Yeah, definitely. That's good to hear. And those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're, just struggling with their mental health and not really sure what to do?
Yeah, I guess, my thought on that would be, not to give up on ourselves, right? Like life is really a struggle
Mm,
sometimes. And I think all of us at some point, one of the universals in life is unfortunately suffering,
mm,
right? And for some individuals more than others, maybe they know suffering too well.
mhm,
And it's easy to lose hope. I think it's easy to devalue ourselves.
mhm.
Um, and I guess I would just say, to try to really kindle, maybe there's just like a small ember of hope in there, right? But to hold on to that and to value oneself enough to get help, because it is out there. And that might take a little bit of time to find the right person, or the right place, but to not give up.
Yeah. Yeah, absolutely. I think that's great advice, and I love the work you guys are doing there and being able to, help those patients really find that relief that they need.
Yeah, thank you, Caleb. I really appreciate the opportunity to talk with you today.
Yeah, definitely. Well, thanks so much for sharing the education on that. That was really great.
You're welcome. My pleasure.
All right. Have a great rest of your day. Appreciate it.
Yeah, you too. Take care.